If you or a loved one is dealing with a cancer diagnosis, then you probably have a lot of questions about what we at the James Clinic and our Integrative Cancer Care Program can do for you. So I thought I'd break it down, answer those questions we get all the time, which may help you make a decision. So the first question we get is, what do you do differently that we don't get from our standard of care doctors? We have a 3-step approach to helping our patients. Step 1 is your body grew a cancer for some reason. So we want to get to the root cause of why that happened. And instead of just cutting off the limb of the tree, find out what's going on at the root cause so that we reduce the chance of you having any more cancers. We stop that process and whatever's feeding that. Now that may be hormones, blood sugar, inflammation, reactivated infections, toxicities. We don't know, but we will look for it and try to mitigate underlying causes in the first place. Step 2 is mitigating damage from other treatments. A lot of patients that we have are already in the midst of standard of care treatments. It may be surgery, chemotherapy, immunotherapy, or radiation that they have side effects from. We have a number of things that we can add to the treatment plan that are going to make those treatments work better and you tolerate them better, so our patients don't look and feel like cancer patients. Step 3 are unique treatments that we have that are outside of the box. So these are things that the system doctors do not have access to and sometimes don't recognize. So that would be things like IV vitamin C, IV artesunate, mistletoe therapy, hyperbaric oxygen, IV ozone, and EBO treatments. So a lot of things that we can add to your routine to help improve your outcomes, a supplement routine, a diet plan, just that support. And what are those things that really move the needle? And that's where we focus in our sweet spot. Another question that we get is, can you treat me with this cancer, specific cancer? And the answer is, since we are focused on you instead of the cancer, we can treat any patient with any kind of cancer. Our focus is you as the patient. And what happens, and if you may relate to this, when you get a diagnosis, all of a sudden everybody is focused over here on your scans and your biopsies and your tumor markers, and they forget there's a person sitting in the chair in front of them that has preferences and opinions and ideas about things. So we are going to keep the focus on you and treat you as the patient and focus on that. So again, no matter whether you have a brain tumor, prostate cancer, colorectal cancer, melanoma, or something no one's ever heard of, we absolutely can add something to your treatment and your care plan. What if I continue to do standard of care treatment? That is totally fine. At the end of the day, we make recommendations and you make decisions, and you as an individual and the patient have to follow your gut. You want to do all of the things of standard of care or none of the things of standard care. That is totally your choice, and we support you no matter where you fall. What we will do is, if you proceed with some of those treatments and we are seeing side effects and things where we need to take a pause or let your body recover a little bit, we'll strongly encourage you to do that. And we'll also give you the verbiage to talk with your standard of care team to try to make those treatments less damaging for you. So hopefully that answers a few questions. Drop the rest of your questions below. We want to get all of those answered. This is a big decision. It can be a big investment in time and financially. And we want to make sure you know how impactful this can be in your recovery.